Okay. So, good morning, everyone, and a warm welcome to another episode of our podcast talk show. And this weekend, I'm very happy to share that we have an honorable guest with us today. That's Shweta Suri, who heads as a director of All About Behavior. And Shweta has been in, counseling autistic children for a very long time, and she has been in this field for over 25 years. So, a warm welcome to you, Shweta, and thank you so much for joining us. And over to you for our topic on support spectrum helping children with autism thrive. Thank you.
Thank you, Pooja, for having me, and Arinda for connecting this. Like Pooja said, I've been doing this for over 25 years, and what mainly ABA therapy is working with children using behavioral analysis. It's applied behavior analysis. It's a treatment that works and has been researched for over 50 years and is pretty much the only treatment that is scientifically proven to help kids with autism, not per, not even just autism, just help behaviorally with predominantly individuals with autism as well. It's not counseling per se, as more as treatment and therapies. We do work on everything from life skills to speech and alert communication skills to daily living skills as well. um, it's so important to have the kids diagnosed earlier, and a lot of times we find parents are really hesitant to have the kids really have a diagnosis and just seek it out help. And what they're doing is not really helping their own children in that way. And I know it's hard for a lot of parents, and we do. So I'm the owner of All About Behavior. So what we do is we also do a lot of parent training. So when you receive the initial diagnosis of autism, you come in, we set up a treatment plan, and we sit with you on a weekly basis and help you understand the behaviors that are occurring in your child's life and understand why they're acting in such a way, so you're incorporated into the treatment on a weekly basis, and if needed more as well. And the earlier you start your kids with the treatment, the better it is. The prognosis is so much better for the kiddos. The behaviors become under control, and we help you do that. We help you understand the strengths and weaknesses and build upon them. And some of our kiddos go into mainstream classroom and with neurotypical children, and some of our kiddos just can't do that, and that's okay. I've worked in a variety of settings, from early intervention to residential treatment facilities as well. So I've worked with the company in the state of Florida, the Agencies for Persons with Disabilities, overlooking and regulating a lot of the residential facilities too. So what I could tell you is, like, and I would encourage anybody who begins to see onsets early on for your child, and it doesn't have to be autism. It could be just a speech delay, or it needs some assistance with occupational therapy or um, physical therapy. There's no shame in it. Help your child out and get, like, treatment, and get the doctor to look at your children right away, because the quicker we get in there, the better we could do, the more support you could receive. And a lot of us get stuck in our kind of like ways of conformity, and having to say that, hey, no, we need to get them into the schools, we need to have education, we need to have them to learn to read. And sometimes we forget that we need to walk before we could run with some of these kids, and we need to just have them learn to communicate. Communication is a big part of kids who are diagnosed with autism, that they have delays in, and that's usually the first sign parents will see, is that the communication is delayed. And some kids are delayed by 6 months to 8 months, and that's quite typical, and there's a standard. But when it gets a little bit more than that, then you want to definitely start looking into things and seeing what was causing the delays. Um, So there's so much help out there, and there's so much research out there. And what we do is, I've worked with kiddos with and adults with intense behaviors, and the longer you wait, the harder it is to control the behaviors and to change the behaviors. Not control, really, is to change those behaviors as they get older, because it does become a form of communication. The frustration increases for the kids, and they're not able to communicate effectively their wants and needs, and hence the behaviors occur. So we help along the lines for the parents to understand that, and we use different formats to help the kids. We do, we use, depending on their skill sets, we start with, simple things. We might need to just start with just sounds, if they're, if the kids at the level that they're producing sounds and babbling, or we realize they're older and they're not producing those, so we have to find another mode of communication. So we start using what's called a PECS, picture exchange communication system, which are pictures of what they want, and they have to exchange it so they communicate to us, oh, this is what we want. With technology now, there's a lot of apps, and you can have an iPad or a phone that the child could walk around with and communicate that way. So there's so many things that we could help with, and there's so many um, other treatments out there too. But with the kids with autism, there's a strong foundation in ABA therapy, and there's good ABA therapists and there's bad ABA therapists. My goal is to spread the word about how great ABA therapy is, because it was getting a bad reputation for a while, because the a lot of the companies that were coming in providing the services were not training what we call the registered behavior technicians appropriately to have effective treatment. Whereas our model is, you start off in our clinic, the technicians, we train them, my business partner and I, individually, and we do not um, have them working by themselves. Beside, they're alongside us, learning the techniques and accurate way to deal with the behaviors and how to implement programs appropriately. We have kiddos that come in that require intense ABA therapy, and these kids are starting out at 40 hours a week. I know that sounds like a lot, but the goal is always to fade out as quickly as possible. And as you go in intense at 40, you're hoping by the 8 months to a year, you're fading those hours out because you've made the changes you need to make, and you're reducing the hours of therapy. And those kids are usually younger. So there's so much information. I'm always available if anybody has any questions. I really think is so important for our community, in particular the Indian community, to be aware and be open and understand that there is so much help out there for us.
Can I ask a question, Shweta?
Sure.
Yeah. So thank you so much for explaining that. And as to Shweta's point, until I met Shweta, and even being a physician, an adult physician, I didn't know much about ABA therapy at all. And through our friendship and her expertise and all her years of experience, I've been starting to learn about it. So, but again, even with this overview, I didn't know a lot. So I think what you're saying is extremely important. There's a lot of, you know, and the stigma maybe comes from fear from the parents, who knows, but your services that are available, a lot of people don't know about. Um, and I don't know if you can share from all your years of experience, maybe the youngest child you've worked with. And then also if you can share with us, does someone have to have an official diagnosis of autism before coming to work with ABA therapy?
Yeah, those are great questions, Rima. The youngest child I've worked with is 18 months. The physician saw the criteria, saw that the child met the criteria for autism diagnosis, and within 8 months, at that time, I was working directly one-on-one with the child. We had him starting to speak in full sentences. He already had some verbal skills present, and we were able to go in and start doing that. With ABA therapy, if you want the intense therapy, yes, insurance companies will only cover treatment if you have the autism diagnosis currently. We do take private pay, but if you're looking for intense therapy, that does become quite expensive. But on the alternate side, we do offer parent training on if needed, if that's where you're at and you don't have the autism diagnosis, but you see that you need some help behaviorally with your child. So there is a lot of that we do as well. And we go according to your needs and what you need, what you want from treatment at that point. So you could come in and you could come in with your child. We could go over some, and of course, it's not as effective as having your child in therapy. But if it's just some things that you need to effectively change behavior, and it's not that intense, then absolutely you could come in and do parent training with us, which we offer as well across the board. Was there another question, Rayma, that I missed? Or were those the two?
No, that's great. Thank you so much. With the 18-month-old, that's really interesting. So were the parents in the session when they're that young?
No, at that time we were doing in-home therapy.
Okay.
We do, I was going into the home. So yes, a parent always had to be around, but they weren't in the session. Again, I used to do the parent training with the parent as well. So the consistency of therapy works across settings and that's why the parent training is so important, is if everybody's implementing the same thing. So we're all singing the same song. So if the kiddo's name says Joe and he is saying say he's hitting the wall consistently every time he doesn't want to put on his shoes. The way we address that behavior has to be consistent from ABA therapy to mom and dad to grandparents to any other caregiver in the setting for you to start seeing change in behavior. If we're doing all this therapy at the clinic and the parents are not consistently following through, we'll say, hey, we've seen the great change in the behavior and we have stimulus control over the child in the clinic. And the parents go, well, at home, we're not seeing any of this. We're still having these behaviors. On the alternate side, we'll say, well, we have an escalation in behaviors at our clinic or during our sessions, even in home. And usually that occurs because we're placing higher demand levels on our kids and we're asking them to complete tasks and we're teaching them. A lot of what we're doing is teaching them through, because it is one-on-one therapy. Every kiddo that comes into our clinic has a one-on-one the whole time that they're there. So we're teaching them that whole time, like say they're there for 4 hours. It's all done either through naturalistic environmental teaching, which means like we go into whatever the kids playing with, we take what they're playing with and what they're doing and incorporate our treatment plans into it. So if we're learning how to talk and label and ask questions, if they're playing with a toy, we'll start with that and we'll go into what I say their world and start asking them these questions and bringing them out, and then it becomes quite reinforcing for them because you're engaging with them. With the younger kiddos, we do a lot of that. So it looks like play therapy, but it's quite intense because the follow through in ABA is what's the most important thing. If you ask a kiddo to complete a task, you want to make sure you follow through the modification on the task. So it could be like put on your shoe, but because if behaviors escalate, it could go to the point that, okay, I'll help you put on your shoe. You don't have to do it independently just because we need the task completed and we don't want to, we understand that once the kiddo is having a tantrum, he's not going to complete the task independently. So it's just understanding that this is the reason why we work on the compliance training, as we call it, is because it becomes so important. Boundaries are very difficult with kids with autism and not understanding when they could do particular things, and it's really important to put it into play, have them understand, well, if we're asking you to do this, it's for safety reasons, and it's because you can't just take off your shoes and walk around barefoot in every setting. You could do it at home, but in certain settings, like in schools and the supermarket. So, just examples of things that we do. We also do a lot of social group work as well. A lot of kiddos diagnosed with autism have difficulty in social situation, again, with the boundaries, understanding rules for games, understanding personal space is something else that sometimes some kids have a hard time with. So there's a lot of things that entails, and it really is every treatment plan that we have come, and every kid that we have come through our door, every treatment plan is different. There's no cookie cutter treatment plan. It is so individualized to what the kid does, and you get about a 30 to 35 page document of the treatment plan and what's going to be addressed.
Oh, wow. Sounds like you have to have a lot of patience to be in the field. I commend you guys for building this, this service that's needed. That's great. How many therapists do you guys have at this time?
At this time, we're growing because there's such a demand. We have about 25.
Oh, wow.
Yeah. So we are consistently growing, and it's just, unfortunately, there aren't enough board certified behavior analysts because every technician needs to be under someone at my level to provide services. So I'm now looking to hire on more board certified behavior analysts as well. We've just taken on 3 part-time. So 4, sorry, part-time, and consistently just looking to take on more. And we might be getting to the level of having a full-time another board certified because I can't fulfill the demand as quickly as I would love to do. The other part of what we're doing here at All About Behavior is our clientele has now asked for a school type setting. And that was always the goal for my business partner, Ali, and myself, to have a school. What we've decided to do at this point is open our school as a non-for-profit. And we're looking into starting off as a homeschool co-op initially, and then moving into a full school setting as it's happening a lot quicker than we could plan for it. But it is kind of like a service that our clientele and our current clients are asking for, and it's something that we feel the need that we need to provide. So we've decided to move forward with a non-for-profit as the school is going to be called Learning Lotus Foundation. And you'll be hearing more about that, hopefully, if you follow us and keep an eye on us in the next coming months.
Oh, congratulations. That's exciting. Thank
Thank
you for
you.
answering the questions and giving us, kind of stories and backgrounds. It's someone not in the field. I have no idea about all that. It's great what you guys are doing.
Yeah. Go ahead, Pooja. Sorry.
That's okay. Thank you so much, Shweta. Shweta, I had a question here. Now, being a counselor, I do a lot of screening with students and in schools, wherein we identify such children with autism. Now, I have a question coming up that when we talk about screening, many parents come to us. First thing is that, they are not willing to accept that their child is autistic. If their first child would be a normal child, and nowadays looking at the lifestyle and the way the things are changing, there are many abnormal pregnancies which are happening, and kids land up with autistic. Maybe they are born with autism, or maybe over the period of time they come to know, oh, my child is autistic, and the there is a very unhealthy environment in the house. And when we try to do the screening, of these children, we realize that the acceptance from the parents is not there. The mindset, they're not willing to accept that their child is autistic, and they don't know what's going to be next, what's going to be the future of the child in terms of academics, in terms of his extracurricular activities, and the growth and development of the child. So can you please a little bit highlight on, how we can address such issues, and, how we can help such children in academics also?
I think with academics, it becomes hard, and what we have to remind the parents is like, you're not. It's very difficult for a parent, and it's not just in the population, in the Indian population. It's across the board. It's very difficult for the parent to understand that their beautiful child that they have has any type of learning disability or any type of needs. And what we have to go in and remind them is like, if we want a better life for your child, then you need to start looking at different types of treatment that's available. The quality of life that you want for your child is really going to be dependent on the services that you find for them, and understanding that it is difficult to accept it, and a lot of times like, well, we don't want to put a label on the child. Well, sometimes that label is going to get you the effective treatment that you need, and the help that you need for your child. And it's just and if you don't have that, unfortunately, even in the school system, if you have an autistic diagnosis, the services that become available to you open up. And even though as hard as it is for a parent, and they have to go through their own struggles to understand it, um, understand that to help your child move forward and to get your quality of life back, and that's the first thing we look at, right, is what is the best thing as ABA therapist, and what is the best way, what is your best quality of life right now? How can we help you and your family have a better quality of life? What is it stopping you from doing that? And that's what you have to keep in mind. If everybody in the family is tiptoeing around putting the TV on because Joe can't hear the loud noises, well, that's not a good quality of life. We need to address those things, and that's what you want to go in there and say, well, how has your life changed with having your child have these symptoms, and not having treatment for it? If there's some way that something and treatment that could help you, wouldn't you want it? And yes, this diagnosis may help you get that treatment, so let's explore those areas. You want to have your quality of life back. And it's just it becomes very hard because we don't know. Right now we believe that autism is a genetic condition, but you can't call it a genetic condition until you find the gene for it. And it's predominantly, if it runs in the family, it will show up in the family lines somewhere as well. So it is, considered a psychological diagnosis in the DSM. I do not provide diagnosis. That's not something that I am able to provide. That has to be through a clinical psychologist or a licensed mental health practitioner or your doctor. Behavior analysts cannot provide diagnoses. However, I've been in the field long enough to kind of be like, yeah, maybe I could tell the parent you might want to go and have your doctor run some tests and things, but it's just run some tests and move forward in that way. So it's really, really important to kind of just talk to the parents and say, how would you like your quality of life to look like? How are you, if you don't start addressing these behaviors or these concerns that you have for the kids, how is it going to how is it how are you going to make it better for yourself and the child at the end of the day as they get older? So it's really just not tiptoeing. What I've learned is you can't tiptoe around it. You just have to address it head on. And as hard as it is for the parents, it kind of just has to be said openly, and so they could start looking at it that way.
So thank you so much. I think what you are doing is truly wonderful. And, we really need such thing, because one thing which comes up, which is very common, is, first thing the question the parents will ask is it covered in insurance? Like, parents, when they come to me also for counseling, the first question is asked, are you all covered in insurance? What are the charges? And I feel that, even if they want to go for the therapy, somewhere down the line, people who really can't afford, like homeless or, from people, there are so many people who want to go in for therapies, but because of insurance and because of less funding available from the government or something or the other, nowadays there's so many NGOs who are providing grants for such children, for such helping them to get a good quality of life, as you rightly said. But definitely, if we come up with such
That
awareness,
is
yeah.
Yeah, that is the main reason we just started our non-for-profit, is
Oh,
because that, we want to be able to apply for those grants. We want to be able to offer the families. My end goal and Allie's end goal has always been to be able to provide services and have a scholarship program for the kids that can't meet the families that, number one, can't meet their deductibles, that can't provide school tuition. So that's the reason we started the non-for-profit organization as well, so we could start looking at those avenues for our families. It breaks my heart when families are like, well, my deductible is $5,000. There's no way I could even meet that. And I know I'm going to,
yeah,
I mean, with the way ABA therapy is, you're going to meet that within the first month to 2 months, and we will work out a payment plan with you and we do the best. But I want to go in there and say, hey, I have a scholarship program that we could tap into. You fill out this form and we'll take care of that deductible. That is kind of like where I want to envision, and we're so new. We just celebrated 1 year of opening, signing our lease yesterday. So, we're growing really fast, and but yet, keeping the end vision in sight is to provide those quality of care to everybody who needs it at the end of the day. And it becomes tough because of that reason. And parents do have those financial obstacles to get over, and the constantly on my mind as I talk to new families that are coming in, or existing families that are like, oh God, it's January, reset of the deductibles, here we go again. It's heartbreaking. So again, that's exactly why we started the non-for-profit, to see what we could do to support those families.
that's really great. I think we need such, awareness, and we need such things to happen, because I believe that unless and until we don't spread the awareness, people won't come up and accept and go through their give take the child to the therapist, and tell them that, look, you can do it. I think the push has to be done from the family. The motivation has to be given to the family. But as you rightly said, having not only just the awareness of spreading the word also really matters a lot. And I think we have a couple of more audience here, and if anybody would like to have ask any questions, we just have 7 minutes left. So if anybody has any question or would like to discuss with Shweta, please go ahead. We're open for discussion.
Shweta, I want to thank you for accepting the invitation to come on the podcast. I think that's, I know it takes a little bit of time away from your main goal and doing what you got to do, but I really fully believe in communicating the work that you're doing, and I really appreciate that. I think that there's so much that we can congratulate you for. You've done amazing, not only in your experience, but just in the recent work that you've done to grow so fast. And it just shows that you are really navigating a place that has a lot of need, and you are doing, your bit in the community to fulfill that. So I just want to, I want to be able to summarize a couple of things that you have said so that we can continue sharing your work and doing our bit and getting that out. So if there's anything that we really want to highlight and kind of put attention towards, what do you think that would be?
I would be, if you're having, as what Pooja was saying, families are having a hard time accepting, I would definitely address the white elephant in the room. I think we need to move forward with that, and understanding, it might be difficult and you might sound harsh to the parents, but it's not being conducive to the child or to them, to not being, as counselors and professionals in the field, to not directly tell the parents, you need to go ahead and look for treatment for your child. This is what we're seeing. Go ahead and get a diagnosis. It could be, again, it doesn't have to be autism. There's so many other areas, and it could be, again, just a speech delay, or they might just need some other help. But just addressing it straight on, and helping the parents understand. I know this is hard to you know I guess understand is what I'm saying, to acknowledge that your child has something wrong with them. But if you in the long term, as the child gets older and they're in their 20s and they're in their 30s and you're having to address these problems, they're only going to escalate. And there are people and places out there that help you do that now. So the sooner you get kids in, if it is at 18 months, and if it is at 3-year-olds, we have a handful of 3-year-olds as well. Let's begin that treatment. And that would be the number one word to get out. And then again, there is help. And if you just need help with behaviors, parent training is available on its own. You don't need to do the intense therapy. That's the other word I would get out there. Just addressing things and just starting with that. And then opening up opening up their repertoire of knowledge of what's available, because I do have in my brain a bunch of knowledge that if it's this or that, here's some other areas that you could explore. Just reaching out for the help, just asking questions. Ask as many questions as you can to you're your child's advocate, you're their voice, you're their person. If you're not going to do it, then who else will do it for their child?
I love that. I love that. Yeah, you answered a whole bunch of things there, because I know that from my experience with the preschool early on, it's so important to recognize that, what, there may be some area of opportunity that we can help your child further, and to
Right.
go ahead and explore that. And I think trying to eliminate the stigma is a huge part of it. So thank you so much for the hard work that you're doing. And congratulations on your new lease, as well as your nonprofit end. And let's just, keep having the conversations.
Yeah, thank you for having me. I appreciate the opportunity.
Thank you, Shweta, and thank you, Arvinder. Thank you, Reema. I would just like to add one more thing that just came up, after hearing the conversation, that, when we see such children, always the parents are quite misguided with what route to take, in terms of therapy also. Like Shweta, you were mentioning about there's a speech therapist involved. There are so many people, involved, or, caretakers involved, I'll be more precise, who are there, and parents really don't know which path to take. So I think, Shweta, if we can have another, topic from you for the podcast, wherein we would like, because I get many such cases, wherein parents are like completely blank as to which route to take. First of all, what are the symptoms, or what are the symptoms where they will know that, yes, my child is autistic? And second thing is, like, as you mentioned about ABA, and, there are other such organizations, or they go to a pediatrician and the pediatrician guides them, So what exactly, if we can have an awareness program, an awareness workshop on autism as to what it is and what is screening and what next, just to give them a limelight that, okay, this is what you need to work upon. This is the path for you, for your child.
Right.
So maybe I
Yeah.
think that would be more enlightening, wherein we give them or show them a broader perspective, and at the same time we help them. We can have more Q&As in that, and we can have it as a workshop, maybe for an hour or something like that. And that was what, because they are completely lost, I feel. They really
Yeah,
don't know
no,
which part to get, and
it,
that's where they become more nervous and they become scared, and they land up in stress.
yeah, it is overwhelming. But yeah, my first guide would be to, like, go to your pediatrician, they could do a screening right away. Again, I can't do the diagnosing part of it, but your pediatrician or neuro developmental psychologist or neurologist, pediatric neurologist, those are the kind of main areas where you want to kind of start looking into and guide parents to go to as your initial stop in finding out, is it autism or is it something else? They'll have a broader scale and screening that they can do.
Sure. Thank you so much.
But
Thank you, Shweta.
I would love to work on a workshop with you guys. Absolutely, for sure.
Sure. We will definitely come up with it soon. Thank you, Shweta, for joining. I'm so sorry the
Thank
time
you.
is a crunch. So I'm, getting the last weeks of less than a minute for a meeting to end. But thank you
No
so much
problem.
all for joining. Thank you, Arvinder. Thank you, Reema. Thank you,
Thank
everyone
Thank
you.
who
you.
joined.
Thanks,
Thank
Thank
you.
Shweta.
you.
Thank
Bye.
you.
Thanks.
Bye. Bye.
Thank you so much. Thanks a lot for joining. Have a great day, everyone.